Hello everybody. So today's topic is going to be kind of sort of on like obsession, to be honest. Obsession regarding hormone levels and transitioning and stuff. And this is definitely going to be applicable to all, but I will say that overall, if I had to pick a demographic that this is going to be seen more often in, it is going to be the more like binary trans femme folks, the ones who are going more for like full feminization changes. So this may or may not be of interest to anybody else, but it certainly does occur with other folks. But anyways, so jumping in, so number one, apologizing up front, because I know that a lot of this video is going to come off as feeling like I'm either chastising or shaming or something, and I do not mean for it to be that way, but I have literally just had so many people that whenever I have this discussion with them who have said, wow, that is very revealing and it's on point and I wish someone would have told me about this, and I mean, I'm just like, well, there's so many people who say this that I guess I'll do a video on it. That's how I decide to do videos, is that I get asked certain things over and over. And so what I usually see that prompts this discussion is I will be contacted multiple times, like I said, usually by trans femme individuals, concerning their testosterone levels, or more specifically their androgen levels. Everybody focuses on testosterone, but it is certainly not the only masculine hormone in the body. So androgen is going to be a term that I'm going to use throughout the video to focus on masculine type hormones, not just testosterone. So anyway, I'll usually see a lot of communication back and forth between a patient or just someone who feels comfortable messaging the clinic about therapy, and they will ask over and over, basically just incessant questions regarding whether or not what they're doing is right, and are their levels perfect, and is there a chance that they are like detransitioning no matter how perfect their levels are, and on and on. I see this a lot. Like, I'm talking probably 75-80% of my trans feminine folks who are doing more like full feminizing therapy come at me at some point and get with this kind of almost obsessive thinking about masculine hormones, androgens. More specifically, they tend to focus on testosterone because, like I said, that's the big one, for sure, that we watch most often on labs, but there are many others. And so whenever I start seeing this pattern, number one, anyone out there who's a healthcare provider who is maybe watching this video, please understand that this is a very real concern, especially for trans femme folks, because society is shit. I mean, anybody who hasn't noticed that our society is pretty much shit towards any categorization of the feminine, then I don't know, you've been living under a rock for a while, I guess. And I'm sorry if I sneezed during the video, my allergies are totally acting up lately. But anyway, so understand, this is a problem that is very real, and even though for the vast majority, and I mean vast majority of people who are experiencing this, this is going to be in your head. And I don't mean in your head as in it's fake or it should be blown off as a concern. Like, that's trash. Your healthcare provider should never blow off your concern like that. But like I said, the vast majority of people, this obsessive thought pattern on masculine hormones is unhelpful, yet understandable, and hopefully, thorough discussion of it can help alleviate some of it. So here's the thing. When we're talking about hormone levels, of course, you want quote unquote good hormone levels, and that can mean different things for different healthcare providers. For myself, if I'm doing feminizing therapy on someone, full femme therapy, not non-binary or like almost like partial full femme, like full feminizing therapy, then depending on whether you're on pills or injections or patches or creams or what have you, I'm going to be aiming for an estradiol level of somewhere between 200 to 500 pg/ml. And I'm going to be aiming for a testosterone level of somewhere lower than 50 NGDL. That can waver back and forth though, depending on the person, because, you know, there's certain conditions and stuff where you might want to let it ride a little bit higher. And certainly I have evidence before my eyes in the form of my patients that shows me that you can have a testosterone level up to 200 in GDL and still transition just fine. But usually what I'm shooting for the first 2 to 3 years or so of feminizing therapy is going to be a testosterone of less than 50, just because that tends to work for everybody. So it's an easy number to shoot for. And it helps ensure, you know, less problems along the way, since some people like 150 may be too high for them and other people it may be fine. Shooting for 50 makes it kind of a blanket, works for everybody. After that first 2 to 3 years, depending on like sexual goals and stuff like that, for like function of the downstairs area, we may let it rise a little bit till function kind of comes back towards what they're happy with. But anyway, so overall, estradiol 200 to 500, depending on when it's drawn and what type of medication therapy you're on, and then testosterone less than 50-ish. So then I'll have someone who basically has a testosterone of 0. Like, I mean, the measurement will say like less than 3 in GDL. So less than 3 testosterone, which you may as well say like 0. There's like a piece somewhere floating around in the ether of testosterone. And they will come to me convinced that somehow they are rapidly remasculinizing. A lot of this is society's expectations, you know. I mean, everybody has their good and bad days, how they're feeling about themselves, how they look in the mirror, and like, I mean, you know, I looked in the mirror this morning and I said, holy crap, what with the hair, and I've gained 4 pounds and now I've got whatever. And you know, then I just feel like crap all day. And then there's some days that I go and I feel perfectly fine. And I'm like, oh, all right, you know, whatever. I'm thick, but I'm happy. This happens a lot with masculine type features for trans femme individuals. And so one day, like a patient had told me, you know, they'll look in the mirror and they'll be like, wow, you know, I can see the rounding out and the softening of my jawline. And then like the very next day, they'll say, oh my God, my facial hair is coming in so fast, and, you know, I have lost the softening of the face. It's just all hard angles, all man all day long. And they, you know, they're very stressed about this. This is, again, healthcare providers out there watching this, this is a very real thing, you know, and whether we see that masculinization or not, which more often than not, we don't, that is still a very real problem, you know, and it takes a lot of understanding and explanation and reassurance and everything to get people past this point. And I mean, it's like trying to untrain your brain of a lifetime of being exposed to all this crap that society throws at you, saying, oh, you know, women only look like this. Women only have this kind of skin. They only have this kind of face shape. They only have this kind of hairstyles and colors and this body type and all that crap. I mean, based off of most of these morons' ideas of what women are, I don't fit in that category, even though I was assigned female at birth. So, I mean, they can all just fuck right off. I just don't even care. But it's easy for me to say that because for the most part, I would have passing privilege, you know, and a lot of trans people, like, no matter how feminized they are, like, you could have, like, perfect transition results, absolutely perfect, and that's perfect, I'm meaning in the eyes of society, not per me or per, people watching the video. Perfect results in the eyes of society, meaning that you pass as the ideal female and all this other crap, and they could look in the mirror and not see it at all. It's the classic case of where, like you see on movies, where it's like there's this beautiful girl and she doesn't realize that she's beautiful. It feels impossible to get these folks who are so focused on the masculine to see past that. It really is hard, and it's something that, from what I've seen in my years of practice, it's going to take years to overcome that. And even then, like, I have some friends who are trans femme, and they've been transitioned for 15 plus years, and they tell me that they still have these days when they look and they're like, oh my god, what's happening? Am I doing something wrong? I look so masculine or whatever. And that again is just going to be that old echoing PTSD from society, just shitting on your brain. Like, no. So let me answer like the question that I've gotten recently, which was, is there any way like that my labs could be perfect, but that I am still losing progress and or masculinizing? And the answer is going to be like 99.99999% of the time, no, you're not going to be masculinizing or anything like that, just with perfect labs. Now, there are additional labs you can do to check whenever, like if someone has legit signs of androgen activity, and they're having these concerns, there are some specialty labs you can check for the other androgens that are in the body. But like I said, the amount of times that I have checked labs and actually seen this be a problem is so few. And most of the time the symptoms that are presented to me are more things that can be either, seen by the mental eye, meaning, what society's put in your brain, combining with your own fears, along with just things that can be caused by other parts to your daily life and everything. Because I mean, there's way more hormones in the body than just sex hormones that can affect how you feel and how things are growing and developing and whatnot. If your cortisol levels are high, that's like a stress hormone, and I mean, you can feel kind of anxious and whatever, and so this can kind of amplify things. And then body hair growth can come and go. It can like wax and wane. It's not like your facial hair growth slows down and then you never ever have a day where it comes in a little bit quicker than normal or a week or whatever. If it persists, like if you have quickening facial hair growth and it persists beyond a few weeks, okay, that may need looking into, or you may have gotten on some kind of an herbal supplement or something else, or be doing something else that could be causing this, rather than you're having a failure of hormone therapy to work. By and large, once your hormones are within range, within a good balance and everything for your transitional goals, this is not going to be an issue, other than what you're having go on up here combined with fears concerning society and transitioning in general. A lot of people turn to the internet for answers and everything. I will say, I don't see a lot of positive, at least not what's presented to me. I mean, and it may just be because since I'm a healthcare provider, when people present things that they found online, it may get filtered differently. So some people may choose not to tell me about things that they learned or heard of online, and others may choose, certain things to tell me. So I don't know. It could be just because I'm a healthcare provider that people tell me only certain things. But by and large, whenever people present me with, oh my God, I was on Reddit in one of the trans forums, and these people were telling me that what was the latest thing? Someone said that they were on progesterone cream and it's going to convert to testosterone, and then it's all over. It's gonna do well. Okay, so I mean, like, progesterone can convert into tons of hormones, androgens, estrogens, cortisol, whatever. So I mean, okay, cream a little less likely. I think that in this case they were thinking about maybe how testosterone cream can be converted to DHT by 5-alpha reductase that's in like the skin whenever you're applying cream. But anyway, so you can see, like, people can take one idea and run with it and apply it to another, and like logically you might think that this is going to make sense, but honestly it's like it doesn't. I mean, that's not really how the hormone cascade works. And so anyways, online can be of help. It might help you develop the questions that you want to ask your healthcare provider. It might kind of help pinpoint what you want to focus on if you're doing some self-research and whatnot. But unless you can prove that whoever you're talking to online has like actual practical experience in this, degrees in this, and even that's not 100%, because there's a lot of crazy people out there who have degrees in like an endocrine science, and they don't really seem to know what's going on other than what they want to put out as a guess. And I mean, that's truly just really poor form. I think if you are a professional and you're putting information out there, don't just make some guesswork out of it or make a happy answer that you think is going to make people feel warm and fuzzy. That's really trash. But anyway, so try to vet people better, I guess is what I'm saying, because I get a lot of folks who just see, a one-off conversation thread on Reddit. Again, I see a lot of stuff from Reddit, and they'll see this stuff and people are just talking about it and giving their own experiences and everything. You don't know if these people are lying or maybe they mean well, but a lot of times I find people exaggerate a lot on there, or they want to feel included in these conversations, and so they just say that this stuff was going on, or they just like creating fear. Those people who are just shit stirrers from birth, like they just like to stir the shit, and so they see that there's this group of people or this one person who posted a question who's anxious about something, and they're like, haha, I'm gonna stir the shit pot, and they just get on there and they say some bullshit. People are people. I mean, whatever. So be real careful with what you're hearing on the internet. It just, take it with like a grain of salt, 2 grains, 3 grains, a whole fucking bottle of salt, whatever. Because it seems to cause more problems than it solves a lot of times. Like, there's so much anxiety that I get questioned about from what people see online, and I'm just like, wow, okay, that just really sucks. But anyway, so back to the matter at hand. Internet can be useful, but can also be very detrimental. Be careful. So again, I see a lot of, and I mean obsession, like I really do mean obsession with androgens and masculinizing. It is real. For the people who are experiencing it, I want people out there to know you are definitely not the only one who thinks that you're somehow secretly masculinizing or having these masculine symptoms and all this. That is not the case. You are not the only one who's thinking this. You're also not the only one who's being affected by this societal bullshit that's in your head and this kind of a PTSD reaction to anything perceived as masculine. I'm here to tell you that, like I said, 99.99999% of the time, this is not what's happening to you at all. Like, if you're getting good quality hormone therapy and your levels are looking good and you're doing all the right things, this is not something that's just secretly or slowly remasculinizing and happening to you. It is just not. Now, like I said, your healthcare provider can run some extra tests on these other androgens and things like that. I mean, if you're going to somebody competent, they should know what to check. If you're not, it's not that hard for them to look up which things they should be looking at for a full sex hormone endocrine panel. But anyway, I just want to throw out there, please be kind to yourselves. Stop throwing yourself into like this whirlwind of obsession about androgens. You're beautiful, you're valid. Like, it's not, and this is not anything to be ashamed of, because like I said, like, I see this from so many trans femme folks, mostly 75-80%, who just absolutely lose their minds over this. And I mean, I'm not talking about the little, you know, like, everybody's gonna have a little doubt here and there or whatever, but I'm talking about full-fledged anxiety and obsession where you think about this incessantly every time you look in the mirror, every time you look at your hands, every time you see your feet, whatever. You're always thinking, is something wrong? What am I doing? This looks like I'm going backwards. One comment that I'll get a lot is, I looked in the mirror and it appears like the facial fat redistribution is going back to a masculine pattern, you know, and I'm like, okay, when did you notice this? And they'll be like, oh, maybe 2 days ago. Facial fat redistribution doesn't happen that fast. Like, no. So this is another thing to be aware of. Fat redistribution for the face or the body takes, at bare minimum, many weeks, like a few months at least, for like this to really make a noticeable difference. And then it's going to take a few years to settle. You could go cold turkey off of hormone therapy and it would still take weeks, months, and years for everything to resettle back to, you know, baseline, so to speak. This is not something that you're gonna wake up one morning and suddenly you're like, oh no, everything has changed. Like, no, that's not what happens. Same thing goes with boobs. Like, boobs can kind of like swell and whatever with water retention in the body and different, you know, various hormones in the body, not just sex hormones. And so that is something they'll, you know, folks will say, oh my God, you know, I'm having breast atrophy. Like, all of a sudden, I'm like, that's not what happens. Even if you suddenly come cold turkey off of hormone therapy, your breast tissue's still gonna be there for a good hot minute. And depending on how much you have, you could retain pretty much all of it. It just may kind of deflate without the estrogen therapy and everything there to help keep it, you know, more robust, so to speak. All these fun words I'm coming up with for boobs. Robust boobs. Anyways, so be aware that these changes and things are not something that just happens overnight or in a week or two or something like that. Like, that's not it. If you're thinking you're seeing that, like I said, it's probably here, not to mean that it's not real for you, a real anxiety. But the actual physical changes, nope, it's not there. Get a good therapist, get a good friend to talk it through to, talk to your healthcare provider. If your healthcare provider is a dork, well, whatever, then like I said, go back to the friend or the therapist or something like that. I know sometimes it's difficult to get enough time in with a healthcare provider to really have a good conversation. So, I mean, that really sucks too. But anyways, so obsession about this, not a good thing. You know, the physical changes are just not there. Let me throw out another. People usually come at me with, they'll say that they're having increased bottom activity or increased thoughts about sex. So here's something to know. Thinking about sex is normal, okay? I mean, you can go through a period of your life where it never even occurs to you because you just don't care, and then you can go through another period where you think about it all the time. It's not necessarily only connected to androgen hormones. It is also connected to estradiol and feminine hormones. So this is not something like if you start having an increased libido or something that you need to run scared about. I would make note of it and see if anything has changed recently or whatever and tell your healthcare provider. But libido itself or thinking about sex and stuff, not a thing that's abnormal or anything by any means. Increased bottom activity is something I would make note of, but the thing is, like, whenever you first start hormone therapy, usually you'll see a sharp drop off in libido and bottom function and everything, but over time, most people, not all, but most people regain some of that previous bottom function, and or libido. It's a little bit different than when they, when they had first started out. I think I have a whole video about that, like the libido and estrogen therapy and stuff. But eventually it's kind of like you reclaim your libido, your sexual function and everything. It's going to be more of a feminine sexual interest and drive and everything at this point, though not quite so all-encompassing as what the masculine tends to be. So this is another thing that can be very normal over time with hormone therapy, and is natural and perfectly fine. And let me be clear, like there is no way to ensure absolute zero testosterone, absolute zero sexual function, absolute zero, all of that. Like that's not possible without removal of the stuff down there. And even then, interest in sex stuff is not guaranteed to go away, because I mean, you still have your adrenal glands that are going to produce both masculine and feminine hormones, and that's going to help drive that. So I mean, this need to get rid of every single drop of masculinity, it's unnecessary. It is unnecessary, and I don't know why society at large, and also within the trans community, I see a lot of that people just like, and it's like an internal shitting on, if there's any masculine interest or anything for a trans femme person, it's like they get shit on. That is trash, complete and utter garbage. I don't know why people do that, other than to be a shit stirrer. Like that, it's not a thing that should happen. I don't understand when people do that. But anyways, so getting rid of all masculine stuff, not possible, because the masculine and the feminine are always intertwined, always. And just for a point of reference for people, like when I've done my own hormone panels as a now 40-year-old assigned female at birth person, my testosterone level when I checked, it was 44 in GDL. So, I have 44. I have people that I have treated with hormone therapy who have like the less than 3, or they have 10 or 20 or whatever, and they absolutely lose their minds because they have that much testosterone, and they have less T than I do, and I'm just like, please be kinder to yourself, because testosterone is helpful in so many other ways than just the sexual and gender type functions that we assign to it. Bone and brain health are very, very intertwined with testosterone and estrogen. We need them both. Please stop trying to eliminate it completely from your system. That is, in effect, harmful, both physically and mentally. I see so many people that seem to stress themselves out over every little thing that's perceived. And I know I'm just harping on this and everything, but I just really want people to understand that this is a process that so many go through, and you're not alone. It is a process that is very real. It is a very real problem. And it takes a long time generally to work through it. And even then, it's not guaranteed that, in 20 years, you're not going to have like a resurgence of it. Because like I said, it's like PTSD. It's always there. But finding a method to cope with it and finding understanding of what the actual realities and things are can be very, very beneficial. So I hope that people found this. I know it was long, but I hope that someone out there, even if one person watches this and gets some reassurance and help, then I am ecstatic about this. And I mean, I know I kind of left the transmasculine folks out and non-binary folks out. I may do a whole other one about transmasculine folks, but I mean, similar things happen just at a much lower rate for those on the more masculine spectrum and everything. Again, be kind to yourselves, find someone to talk to, get good information, watch where it's coming from. And if you have questions, again, just feel free, write in. You know, it's not a big deal. Whenever I get free time, I answer. You know, eventually I may get too many people writing for me to be able to answer, and I'll just, like I said, I'll do videos and stuff. But, you know, be kind to yourself and everyone else. Hope this helps. Bye.